Health, which is the government, of course, and the doctors. Thank you for joining us. And in Nyeri, let's take a look at some of the reactions we've gotten since morning, since that particular ruling was delivered at the Court of Appeal. Joining us now for that is our senior reporter, Carol Nderi from Nyeri County. Good afternoon, Carol. In Nyeri, how was this news received? And I'm sure you've done a spot check in various hospitals there. What is the situation?
Good afternoon to you, Akisa. Yes, we went around Nyeri County earlier on today. We could say that the situation here is relatively calm. I was watching the pictures coming in from Kisumu County where doctors showed their solidarity with fellow doctors. Here in Nyeri County, we tried reaching out to the KMPDU officials. One of them, Dr. Gudi Gor, an official of KMPDU Nyeri branch, and they told us that a majority of them had traveled to Nairobi from Nyeri to also show their support and solidarity in that way by camping there in Nairobi together with other colleagues and counterparts from different parts of the country. And of course, there's a new turn of events with the Court of Appeal releasing the doctors, but with private hospitals, most of them in other parts of the country, we've seen private clinics closed. But here in Nyeri County, a spot check revealed that some of these clinics were still in operation, with most of them saying that they are satellite clinics. We're talking about, we went to Karen Hospital, the satellite clinic that is in Nyeri, went to Aga Khan, went to Meridian, and they said that they were still in operation because their satellite clinics, they could only do so if they got orders or directives to do so from Nairobi, that is the headquarters. So most of them said they were together with other doctors in spirit, but they could not close down the clinics just as yet. But they said if there was a vigil, they were going to join that particular vigil, but they said they were together with other doctors. Now, with the new turn of events, of course, the doctors' release, many are hoping now that the talks will be expedited, that the tug of war between the government and the doctors will end. Of course, the Mwananchi residents, just even here in Nyeri, public facilities are still closed. We're talking about the Nyeri County Referral Hospital, and a number of public facilities are still closed. Just to give us his views, we are joined by the majority leader at the Nyeri County Assembly, Duncan Gitwanja. Is also an MCA in charge of Kafaro Ward here in Nyeri County, but he's talking in his capacity as the majority leader at the Nyeri County Assembly. Mheshimiwa, thank you for joining us on KTN. What are your thoughts? At least maybe we could start from the release, the ruling that has just been made by the Court of Appeal. Thank you.
I think the Court of Appeal has done well to release the doctors, and it's welcome. I didn't see any need for jailing doctors because there will be no solution, because they are the officials who are going to bargain and negotiate. And I hope now the government will be willing, because now jailing them was not a solution. Hospitals are still closed. The referral hospital in Nyeri cannot work. So we are hoping that there shall be a solution now that the Court of Appeal has ruled that the doctors be released.
Okay. Bwana Gitwanja, as a leader of majority of the Nyeri County Assembly, there's been lots of talk regarding, since health was devolved. Initially, they said those were teething problems, all the problems that were seen in all the 47 counties. But we are seeing, of course, years down the line, there's still a lot of setbacks and a lot of hitches. What are your views regarding devolution of health services?
I think we need to sit down and talk and see, did we require devolution to devolve all the hospitals? Because personally, I thought the referral hospitals should have left the national government, and we could be left with from level 4 hospitals downwards. Because I think referral hospital like Nyeri County, the PGH, which is the referral hospital, the amount of money we are given is too little to do anything. So we thought that this hospital serves the region. Even now, does not serve Nyeri County only. This hospital is in charge of the whole region. So we thought the constitution was right, yes, but some of these things would have been well thought. And now there's a chance that the government should sit down, the cabinet secretary should sit down, the council of governors, discuss. Do we really require to devolve the referral hospitals? If no, let's retain the referral hospitals at the national level, and let's devolve from level 4 downwards.
Okay. And the doctors are insisting that, of course, it's a mixture of feelings or different views from Kenyans, some supporting the doctors, some supporting the government. They're talking about the CBA. The doctors saying it is not just about their pay, it's not just about their salaries. What do you have to say?
I think it's all comes down to negotiations. Doctors should come down, negotiate with government. Government should come down, negotiate. Let's remove the egos. Where we say if you don't want this, then we don't want this. So I think doctors should also try not to be so radical. Government not be so radical. Let them come to a table and agree. CBA, no CBA, let them agree and come to a negotiation. Because the public is complaining health services are down up to now.
All right, thank you very much. Duncan Gitwanja, leader of majority at the Nyeri County Assembly, saying, of course, that the two sides should stop being strong-headed or radical, just to calm down, spirit of compromise for the sake of the Mwananchi, the resident, not just in Nyeri County, but every person in the country. Back to you, Akisa.
Carol.